8:09, the Centers for Disease Control and Prevention's Vaccine Advisory Panel voted Friday on a major change to infant vaccinations. The panel voted to change the recommendation for when children should get their first dose of the hepatitis B vaccine. And instead of a first dose within 24 hours, the panel now recommends delaying it until a child is 2 months old. Major medical groups say this puts infants at risk and undermines decades of progress. Joining us this morning to help us make sense of all of this, break it all down, is Dr. Irwin Redlener, founder of the Children's Health Fund and professor at Columbia University. Good morning to you. Thanks for being with us.
Thank you for having me.
Obviously, it's just such an important issue and topic right now. I want to get just your reaction to the CDC's panel decision to delay this hepatitis B dose. Obviously, a recommendation that has been in place for more than 30 years.
Well, yeah, so the first thing that many experts, myself included, noticed was why on earth would they change a policy that was both safe and really effective? And there were no particular concerns that might have prompted a dramatic change like this. And in fact, before we had the vaccine, we were seeing about 200,000 cases of children infected with this hepatitis B virus. And then after the vaccine was developed and became universally given to every baby right after birth, that dropped by 90 to 95%. And when you get hepatitis B as a baby, it could lead to extraordinarily serious liver disease, chronic liver disease, and sometimes liver cancer later in life. So it made no sense whatsoever. We're still trying to figured out why on earth a so-called professional advisory committee would try to change the procedure at this particular time. It's very unfortunate.
Yeah, and obviously just a lot of questions right now for a lot of new parents and expecting parents. How should those parents kind of approach this conversation with their pediatrician? What do you want them to know right now?
Well, what we want them to know, and I just want to be very direct about this, is that this is a mistake not to vaccinate newborns right after birth. It works, it's safe. And what's happening is that many policies under the umbrella of authority of Robert F. Kennedy, the Secretary of HHS, are undermining. If you're a parent, I'm looking at you and saying what they're telling you is not true. I know he's the Secretary of HHS, and the CDC and the advisory panel are the authority. But right now, they're giving you false information. And the best thing for your baby is to get that vaccine. Listen, I'm a grandparent and a parent, and I wouldn't even dream of not getting my children vaccinated, especially when we know the vaccine is safe and it works. So that's the conversation really with your doctor, which is that, yeah, I want to get this vaccine protection for my baby.
Yeah, we have just about 30 seconds left, but I want to ask you, just from a medical standpoint, what is your biggest fear in delaying that first dose for those infants?
Well, there's a lot of ways that babies can get hepatitis B other than through transmission from the mom to the baby just before or during birth. And that could come from people who are infected and otherwise may not know it. And children get infected from, everything from touching or putting their fingers in their mouth after they've touched any kind of liquid, a toothbrush, whatever can transmit that hepatitis B vaccine, B virus, and the vaccine will help really prevent almost all the infections, no matter how they're transmitted. So it really is critical for babies to get vaccinated really right after birth.
All right, a lot of important information, a lot still developing here for those new parents, especially Dr. Irwin Redlener. Thank you so much for your time and your insight. We appreciate you.